Let's talk about balloon sinus dilatation, or as many know it, balloon sinuplasty. It's a procedure that's gained a lot of attention recently, and for good reason. Why? Because it's a minimally invasive way to treat chronic sinusitis. Imagine being able to restore normal sinus drainage without the need for traditional, more invasive surgery. That's the beauty of this procedure. So, who is this procedure really for? Well, it's ideal for patients with chronic rhinosinusitis who just aren't finding relief from medications. You've probably seen this in clinic, a patient with ongoing sinus pressure, drainage issues, and infection despite months of antibiotics or nasal steroids. Balloon dilatation works particularly well when the disease is localized, affecting sinuses like the frontal, maxillary, or sphenoid, but when full-on surgery isn't necessary. Now, let's walk through how the procedure actually works. Picture this: the patient is either under local or general anesthesia. A tiny, flexible balloon catheter is inserted through the nostril, and it's guided to the blocked sinus. Once in position, the balloon is inflated. This gently expands the sinus opening, reshaping it to improve drainage. Then, it's deflated and removed, leaving the sinus passage wider and more functional. No cutting. No tissue removal. What makes this approach really appealing? First, it's minimally invasive, we're not cutting into bone or tissue. Second, recovery is fast, many patients are back to their routine in just a couple of days. Plus, there's less bleeding and scarring compared to traditional sinus surgery, and often it's an outpatient procedure, done right in the office with just local anesthesia. And does it work? Yes, most of the time it does. Studies show significant symptom relief in the long term for about 90% of patients. But, and this is important, proper patient selection is key. Not everyone will benefit the same way. Of course, we can't forget about the risks. While rare, complications like infection, bleeding, or mucosal damage can occur. And there's always the chance that symptoms could return, leading to the need for additional treatment. In conclusion, balloon sinus dilatation offers a great alternative for those specific patients with mild to moderate chronic sinusitis who don't need traditional surgery. It's quick, effective, and has fewer complications. But, as always, choosing the right patient is everything.